Welcome to the deep dive. Today, we're taking a shortcut, really, into a fascinating and, well, rapidly growing area, IT solutions for integrated operating rooms. Now, you might be thinking, integrated ORs, what does that even mean?
Yeah, it's a term you hear a lot more now.
Exactly. So picture this. Instead of, a surgeon juggling multiple different screens, one for vitals, another for imaging, maybe another for robotic controls.
Right, a bit chaotic sometimes.
Totally. Instead, imagine a seamless networked environment that's basically an integrated OR.
Where everything talks to each other.
Precisely. All the critical systems, data, devices they communicate, giving the surgical team real-time consolidated info.
And the IT solutions we're discussing today.
They're the backbone, the software, the hardware, the networks, everything that makes that integration actually work. So our mission today is to really unpack the key takeaways from a pretty comprehensive market forecast by Cognitive Market Research.
A lot of good data in there.
Definitely. We want to go beyond just the surface numbers, explore the why behind the growth, looking at 2021, projecting out to 2025, and then all the way to 2033.
And those CGR insights, too.
Ah, yes, the CGR compound annual growth rate.
Mm-hmm.
For anyone maybe not familiar, it basically smooths out the growth over time, gives you that average annual rate, paints a clearer picture,
A better sense of the long-term trend.
Exactly. So get ready for some pretty surprising trends and hopefully a clear understanding of where this vital field is headed.
Okay, so to really get a handle on this transformation, we kind of have to start with the global numbers. And believe me, they are pretty explosive.
They really are.
So looking at the whole market for IT solutions and integrated ORs, what's the big story? Is it just steady growth, or are we seeing something, well, more dramatic?
Oh, it's absolutely dramatic. This market isn't just, growing steadily, it's surging.
Yeah.
There's incredible momentum.
Okay, give us the numbers.
Right. So back in 2021, these IT solutions generated just over $3.15 billion globally.
By 2025, the projection hits $4.45 billion. And then, fast forward to 2033, we're looking at a massive $8.88 billion.
Wow. That's...
Yeah, and that translates to a really robust compound annual growth rate, that CAGR, of 9.02%.
nearly tripling in just over a decade. That's huge.
It is.
What's fascinating here, though, isn't just the numbers themselves, right? It's the forces behind them. This isn't just happening in a vacuum.
Absolutely not. No,
Yeah.
this significant growth, it's directly tied to these major trends that are really reshaping healthcare globally.
Like what specifically?
Well, think about the whole digital transformation push in healthcare.
Yeah.
It's huge. Moving away from paper, from siloed systems,
Right.
towards fully integrated, intelligent platforms. Then there's the aggressive modernization efforts we're seeing in hospitals everywhere. They want smart operating rooms.
What sense?
And maybe most crucially, there's this continually increasing demand for real-time data right there in the operating room.
So it's about efficiency.
Efficiency, yes, but also safety, enhancing surgical precision.
Mm-hmm.
Ultimately, it all leads back to better patient outcomes.
Okay, so that's the really impressive global forecast. Let's maybe turn our attention now to where this growth is happening. Where are the engines?
Good question.
Let's take a trip, maybe continent by continent, see where the surgical revolution is really taking root. Where should we kick things off?
Let's start with North America. It's not just a leader in terms of market size, but often, a bellwether for a lot of these healthcare tech drugs.
Okay, North America. What did the numbers show there?
So this region recorded over $1.18 billion back in 2021.
Right.
And it's set to reach more than $3 billion, $3.047 billion, actually by 2033.
Mm-hmm.
That comes out to a healthy CAGR of 8.176%. Still very strong growth.
And breaking that down within North America, how do the big players compare?
Well, within North America, the U.S. is, as you'd probably expect, the dominant player. It accounted for over $910 million in 2021.
Okay.
And it's projected to hit more than $2.25 billion by 2033.
Still the lion's share.
It is. But what's really interesting, I think, is Canada.
Oh, yeah.
Yeah, Canada's posting a particularly strong CAGR, 9.374%. It's growing from about $171.8 million in 2021 to projected over $500 million, $505 million by 2033.
Wow, that's quite a jump. Mexico.
Mexico also shows solid growth, forecasting nearly $290 million by 2033. So strong across the board, really.
That Canadian KGR, though, it's noticeably higher than the U.S. Any thoughts on why that might be? Why the accelerated growth up north?
That's a great question. Well, both countries obviously have highly developed healthcare.
Yeah.
But Canada's system, being largely public,
Right.
it might be seeing more, let's say, centralized or coordinated investments in digital infrastructure across its hospital networks,
Ah, yeah.
which could potentially lead to a more streamlined, maybe faster adoption of these integrated solutions compared to the maybe more fragmented private sector dynamics in the U.S. Just a thought.
No, that makes a lot of sense. A different approach to implementation. Okay, so North America clearly setting a strong precedent. But if we look eastward now, across the Atlantic, what's the story in Europe?
Europe's market was around $863.5 million in 2021. So a bit smaller than North America to start,
Okay.
but it's expected to more than double, hitting $2.3 billion by 2033. And that's with a robust CAGR too, 8.559%. Very solid.
So it's similar growth trajectory, really.
It's pretty similar, yeah.
Mhm.
What's quite noteworthy here is just the consistent expansion across a really diverse range of healthcare systems in Europe.
Right, it's not monolithic. Which countries are really driving that momentum over there?
Well, places like the UK are showing really strong momentum. Revenues there rising from $145 million in 2021
Uh-huh.
to nearly $450 million projected by 2033. And that boasts a really high CGR, actually 9.888%.
Higher than the European average.
Yeah, definitely standing out. Germany is also notable, climbing from $182 million to over $537 million.
Big numbers there, too.
Absolutely. And France and Italy also contribute substantially. Each of those is growing to over $200 million by 2033. And then you see consistent growth pretty much everywhere else you look. Russia, Spain, Sweden, Denmark, Switzerland.
Yeah.
It really highlights a broad embrace of these technologies across the continent.
Okay, now, here's where you said it gets really dynamic.
Ah, yes.
Asia Pacific. You mentioned explosive growth. What makes this region such a powerhouse in this particular sector?
Yeah, Asia Pacific is, without a doubt, the most dynamic growth engine right now.
Yeah.
Revenues there jumped from around $655.5 million in 2021.
Right, smaller start than Europe.
Smaller start, but projected to hit $2.19 billion by 2033.
Mm-hmm.
And get this, the region leads globally with an impressive CAGR of 10.546%.
Wow, double digits. What's driving that?
It's really multifactorial. You've got rapid infrastructure development happening in many countries,
Okay.
growing populations who are demanding better healthcare access,
Yeah.
and often a real willingness to adopt cutting-edge tech.
Hmm.
Sometimes they can leapfrog older systems that maybe Europe or North America are still dealing with.
That makes sense. So within Asia Pacific, who are the leaders? Any standout figures there?
Well, China dominates a significant chunk of this market. It's leaping from about $261 million in 2021 to nearly $884 million by 2033.
Yeah.
Huge scale.
Massive market.
Absolutely. But, what's truly remarkable, I think, is India.
India. How so?
India shows one of the highest growth rates, well, globally. It's moving from about $81 million in 2021
Uh-huh.
to a projected $342 million by 2033. That's an incredible CAGR of 12.667%.
12.6%. That's phenomenal. What's behind India's surge?
It seems to be a combination. The sheer scale of India's healthcare needs, obviously, combined with its rapid digital adoption across many sectors,
Right.
plus government initiatives focusing on public health infrastructure, it's all kind of converging to propel that growth.
Fascinating. And other players in the region.
Oh, yeah. We also see really strong expansion in Japan, South Korea, Australia, Singapore, Taiwan. It's a very active region overall.
Okay, so we've covered the big three, North America, Europe, Asia Pacific. But it's not just the established giants, right? You mentioned other parts of the world are also contributing significantly.
That's absolutely right. These emerging markets are really important to the overall global picture.
So what's happening there? Let's talk South America first.
Okay. South America's market is set to grow from roughly $224 million in 2021 to over $657 million by 2033.
Solid growth there, too.
Definitely. Brazil is really leading the charge there. It's increasing from $87 million in 2021 to over $270 million by 2033. A lot of that is driven by a big push to modernize hospital infrastructure.
And others.
Argentina, Colombia, Peru, Chile. They also show strong growth trajectories as healthcare access continues to expand across the continent.
Okay. How about the Middle East?
The Middle East market is forecasted to move from about $135.5 million in 2021 up to $364 million by 2033.
Also more than doubling.
Yeah, and that's primarily led by countries like Saudi Arabia and the UAE, where you see significant investment going into really high-tech medical facilities. They're building state-of-the-art hospitals.
Yes, you hear about that. And finally, Africa.
And Africa's market is surging, too, from about $88 million in 2021.
Smallest starting point.
Smallest starting point, yes, but projected to grow to over $302 million by 2033.
Still a significant jump. Any specific countries?
Nigeria in particular is interesting. It's projected to reach over $86 million itself, with a KGR of 11.436%. Really high growth.
Oh.
And South Africa also showing growth rates exceeding 10%. So these regions might be, playing catch-up in some way.
Yeah.
But they're doing it with incredible speed, really leveraging these new technologies to bridge gaps in healthcare delivery. It's quite impressive.
Absolutely. Okay, so we've done the global numbers, we've toured the regional growth engines. Now let's bring it all together. For you listening, maybe you work in healthcare, maybe in tech, maybe you're just curious about where medicine is going. What does all this mean? What's the bigger picture here?
Right. Connecting all these dots, this comprehensive outlook, it really demonstrates the immense, almost undeniable potential of these IT solutions for integrated operating rooms.
It's not a niche thing anymore.
Not at all. The consistent, really robust growth we see across almost all regions. It's not just about revenue figures on a spreadsheet. It underscores, I think, a global commitment.
A commitment to what?
To improving surgical outcomes, fundamentally. To streamlining complex procedures, making them more efficient, and, crucially, leveraging technology to enhance patient care on a really basic level.
Can you give some examples? What kind of solutions are we actually talking about here?
Sure. We're talking about things like advanced visualization systems. Imagine giving surgeons these incredible 3D real-time views inside the body.
Yeah.
Or seamless robotic integration that allows for minimally invasive procedures with unbelievable precision, things that weren't possible a decade ago.
Right.
And data analytics platforms. This is huge, too. Platforms that can learn from thousands, even millions, of past surgeries to help optimize future ones, maybe even predict complications.
That's incredible potential.
It really is. And the demand for that real-time data, for predictive insights, for that seamless integration within these absolutely critical environments, it's only going to intensify.
Yeah.
We're moving towards an operating room where every piece of vital information is instantly available, structured, usable.
Which would reduce errors.
Reduce errors, improve decision-making under pressure,
Yeah.
and ultimately, that translates to faster recoveries and, frankly, better lives for patients.
What an incredible deep dive this has been. A really crucial and clearly rapidly evolving market.
Absolutely.
From North America's, strong foundation to Asia Pacific's just dynamic expansion. It's abundantly clear that these IT solutions are profoundly transforming operating rooms, well, everywhere.
The data certainly points that way.
Yeah. We've seen how those big trends, digital transformation, hospital modernization, and that critical increasing demand for real-time data, how they're driving adoption in literally every corner of the globe.
It's a fundamental shift.
It really feels like it.
Yeah.
A shift in how we approach surgical care, making it safer, more efficient, more precise.
That's the goal.
So this deep dive, it really makes you think about what comes next, doesn't it?
Always.
As operating rooms become more and more digital, more integrated, what new, maybe ethical considerations or even logistical challenges might pop up?
Good question. Things like patient data security become even more critical.
Cybersecurity, yeah.
Yeah.
Or even the evolving role of the human surgeon in these super tech-rich environments.
Right. How does the human element adapt and integrate?
Exactly. And how do you think healthcare systems themselves globally will need to adapt to keep pace with these changes in the coming decades? Lots to think about.
Definitely.
Something for you to ponder long after this deep dive is over. All right, buckle up. Welcome to the deep dive. Today, we're plunging into, well, a really transformative realm, IT solutions for integrated operating rooms. Our mission with this deep dive, it's pretty simple. Cut through the noise, pull out the absolute core insights from our sources, and get you quickly up to speed on this kind of game-changing digital revolution in healthcare. We're talking about what's reshaping modern surgical environments, extracting those maybe surprising nuggets of knowledge so you can be truly well-informed.
Yeah, and looking at the sources, one thing that immediately jumps out is how digital intelligence and precision aren't just improving surgery, they're fundamentally redefining it. We're moving beyond like the traditional OR to something far more connected, intuitive, and frankly smart.
That's a perfect way to set the stage. So as we dug into the why, some fascinating insights emerged about what's really fueling this rapid adoption. What's the first big driver we uncovered? Well, our sources clearly show this intense pressure for hospitals to become more efficient. It's really pushing the demand for workflow optimization. Integrated operating rooms, or ORs, They're evolving into what you could call smart surgical hubs. Just imagine an environment where IT systems seamlessly connect, well, everything. Every instrument, every imaging system, every data platform. The real magic here, you'll find, is how these systems can virtually eliminate that time-consuming manual calibration of instruments. It lets surgeons jump directly into procedures with like unparalleled accuracy, almost like having a digital co-pilot. It's boosting surgical precision, dramatically minimizing setup time, cutting down on human error, and truly streamlining the entire workflow. That's really why hospitals are investing so heavily.
And diving deeper into that efficiency piece, what's often overlooked, perhaps, is the profound impact on patient flow. When you optimize every second and every move in such a high-stakes environment, it's not just about the surgery itself, right? It speeds up the entire process from check-in to recovery. And that leads to much better outcomes for you, the patient. Plus, it allows the hospital to serve more people.
That's a crucial point, yeah. And building on that, another major driver our sources pinpointed is the incredible expansion of minimally invasive and image-guided surgeries. These cutting-edge procedures, just by their nature, they demand real-time imaging, robotic intervention, and incredibly precise device coordination. Integrated ORs don't just support these, they actually make them truly viable by centralizing control of all the equipment.
It really makes you wonder, doesn't it? Without this level of seamless integration, many of these advanced procedures just wouldn't be safe enough, or maybe not even possible. Think about neurosurgery or complex cardiac procedures. The margin for error is just microscopic. Integration provides that crucial real-time feedback loop. It kind of acts as a safeguard that elevates patient safety.
Right. And it's not just about what's happening inside the OR itself. Our deep dive also revealed a global surge in hospital investments and smart infrastructure development. Governments, private healthcare providers, they're pouring resources into digital transformation. It's making integrated ORs, backed by robust IT solutions, absolutely essential for modernizing facilities and delivering truly patient-centric care. It's definitely a global push for better, smarter healthcare. Now, of course, nothing this revolutionary comes without its hurdles. So what does this all mean for the obstacles the market faces? What was the sort of most pressing challenge our sources detailed?
Well, one of the biggest, most obvious barriers is the high initial setup cost and the ongoing maintenance cost, too. We're talking about a pretty substantial financial commitment, from purchasing advanced hardware and software to integrating all these disparate systems, and crucially, training staff. This is especially true for facilities in emerging regions, where budgets are often stretched pretty thin.
Yeah, and while the sticker shock of these systems is very real, what our sources underscore is that the long-term ROI often paints a very different financial picture. For reduced complications, faster patient turnover, increased capacity. It really shifts the perspective from just an expense to a strategic investment. But yeah, that initial hurdle can still feel enormous, especially for healthcare systems with, tight budgets.
And then there are the complex interoperability and integration challenges. Hospitals often have this patchwork quilt of old and new surgical equipment from various vendors. Ensuring seamless communication between all these devices isn't just tricky, it requires complex and often pretty costly custom integration. Without that cohesion, real-time data delivery and surgical efficiency can really suffer. It's a bit like trying to get a symphony orchestra to play perfectly when half the instruments are speaking different languages, right?
Absolutely. And the broader implication here is that this isn't just an IT problem, not at all. In a live surgical setting, any data bottleneck or communication lag can have immediate critical consequences. It's not just about getting the systems to talk. It's about them talking instantly and flawlessly under immense pressure. It truly highlights the need for industry-wide standards, which, well, are still evolving.
Right. And finally, our sources repeatedly pointed to a shortage of technical expertise and, frankly, insufficient training. Operating and maintaining an integrated OR demands skilled IT professionals and clinical staff who are genuinely comfortable with these advanced systems. Many healthcare facilities face a steep learning curve, and honestly, there can be resistance from teams accustomed to conventional surgical setups. I read one anecdote in a source about a veteran surgeon who initially called the new integrated system just another fancy light show, but they quickly changed their tune after seeing how it shaved precious minutes off their toughest cases. It's that kind of practical impact that really changes minds, I think. So looking ahead now, where is this all going? What are the big trends shaping the future of the space that our sources emphasize?
Okay, a huge one is the accelerating adoption of artificial intelligence, or AI, and data-driven surgical decision support systems. AI is playing a truly transformative role. It's enabling real-time analytics, predictive diagnostics, and interoperative guidance. These tools aren't just fancy add-ons.
They're helping clinicians make more informed decisions. and they're contributing to significant post-operative quality improvements and solid evidence-based practices.
Yeah, one thought that immediately comes to mind is just how much more precise and personalized surgical care can become when it's supported by intelligent systems in real time. I mean, imagine AI predicting complications before they even manifest, or optimizing a robotic arms movement down to the millimeter based on a patient's unique anatomy. The possibilities are truly expanding surgical boundaries. It's quite something.
Exactly. And another game-changing trend is the integration of telemedicine and remote surgery capabilities. Our sources describe how high-definition live streaming, teleconsultation, remote assistance, they're creating entirely new opportunities.
Yeah.
Opportunities for expert collaboration, surgical education, even second opinion models, regardless of geographic location. This is especially crucial for expanding access to quality care in rural and underserved areas, really bridging geographical gaps that once seemed, well, insurmountable. And finally, as operating rooms become more digitized, the threat of cyber attacks looms larger. It's just a reality. So there's a growing, absolutely critical emphasis on cybersecurity and regulatory compliance. Hospitals are increasingly investing in robust, secure IT infrastructures and compliance solutions that meet stringent healthcare regulations like HIPAA, which is crucial for patient privacy in the US, and GDPR, Europe's data protection law, and standards like HL7 that ensure different hospital systems can talk to each other securely. Protecting patient data while ensuring operational continuity is now really a top priority for surgical centers everywhere. So wrapping up, what does this all mean for you? We've navigated the complex landscape of IT solutions for integrated operating rooms. We've looked at what's fueling their growth, the significant challenges they face, and where they're heading.
Yeah, zooming out for a moment, we're truly witnessing a profound digital revolution in surgical care. No question. While challenges around cost, integration, and training definitely persist, the undeniable benefits are driving strong adoption. Benefits like improved surgical outcomes, streamlined workflows, global connectivity. With AI offering intelligent assistance, remote access expanding care, and cybersecurity becoming paramount, the future of surgical care truly looks smarter and more connected than ever before.
And a final thought for you to consider. As operating rooms become smarter and more connected, how might this fundamentally change not just the surgical experience itself, but also the recovery process, and maybe even the long-term health monitoring for patients like you, perhaps in ways we can only begin to imagine right now? Food for thought.